Here's an email which I received from Dr. P. And this is in Virginia. A classmate of mine is your client, and he attributes his great success to your coaching advice. Thank you very much for that. That's very kind. My practice is 9 years old with a reasonable revenue. I'm looking to add services. A good friend of mine is an acupuncturist and would like to work in my clinic. Should I work with him? There is no question that adding more services to your clinic, broadening the scope of your practice, is always beneficial, not only to you from a financial standpoint, but also to your patients. As a matter of fact, I would rephrase this by saying that it's always beneficial to your patients first. And when it is beneficial to your patient, it's beneficial to your clinic, and therefore to your community, and therefore also to your revenue. There's no doubt whatsoever that adding a secondary services will change some of your practice protocols and broaden the scope of practice, attract more patients. I do want to make a comment, however. You do realize that when you bring in an acupuncturist, this is someone who is somewhat different than your practice and may have a different philosophy. They may add a little more nutrition. They may decide that, for instance, some of those needles that go in have to involve some of the medications, whatever the case may be. I did, by the way, in my practice, I had an acupuncturist, and the doctor was the real thing. I had a true acupuncturist. He was good at it, he understood it, and Oriental Chinese medicine was his deal. He was living, walking, talking, thinking, sleeping that way. That was just what it was. And it added a tremendous effect to my practice. However, there were times when we competed for the same patient. You'll have to realize that some of those patients that are going to be coming in will have a diagnosis that could be treated either by a natural health care manipulation, whatever the case may be, using modalities and all that, what have you. And it also could be treated by acupuncture. At times you're going to see some type of competitive edge in there. And if that's the case, nothing wrong with that. Nothing wrong. You could decide to treat them first yourself as the doctor, and then you could send them to the acupuncturist afterwards. It's up to you. But know that there will be times when these two treatments will correlate to one another and somewhat be competitive with each other. There'll be also some patients that may like one treatment versus the other. I would not try to cross those patients. You don't want to make any patient confused as to what works or doesn't work, or what philosophy is and what isn't. I would first recommend that if the patient came in for acupuncture, let them get the acupuncture treatment. Stop right there. If they're pleased with it and their services have been phenomenally successful, and the patient walks away saying, I feel great and my condition has been treated properly and I feel good about it, stop. There's no reason to bring in another treatment. Now, you can always expand to various other things. If you have a weight loss program, for instance, this is something which is not a contradiction. But I wouldn't double the treatment in any way. I would not do that under any circumstances. I hope this answers your question, and congratulations on broadening your scope of practice. But of course, there are legalities involved, possibly in your state, so make sure that you do consult with a qualified healthcare attorney and let the proper counsel give you information as to how this is to be done. There's going to be 3 issues that you're going to encounter. One is going to be possibly a legal issue, an accounting issue, and a marketing issue. From a legal standpoint, very simple, call a healthcare attorney, as I just suggested. Make sure that they're qualified in this field. Ask them the question, find out how to do it, and then that can be done. The second, which is an accounting issue, speak to your accountant, let them know how the packages of the services and things like this are going to be compensated for, and how to handle the money. The third, which is the marketing, make sure that you now encompass in your practice, make sure, of course, that the board knows about this and all this is acceptable through your attorney, how to market for this, because now you broaden your scope of practice and how it can be done appropriately. I wish you the best of luck, and I hope to hear good news. Please write me a note when you can and let me know the results of this addition to your services. Thank you very much, and I hope to hear from you very good. Please subscribe to my YouTube channel and click the notification bell to get my latest update.